Okay, Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir. We were discussing the pectoral region, and I told you that the first structure that comes over here, it is the skin. And the skin of the pectoral region, it is modified by one thing that is present over here in the skin of the pectoral region is the areola and the nipple of the breast. Then when you remove the skin, deep to it, you would see number one, the quantity of fats, which is subcutaneous fats. Then you would see the nerves and vessels entering into the skin, which are called as subcutaneous, cutaneous nerves and vessels. Then, in case of female, over here, deep to the skin, you will find the mammary gland or breast tissue. And then you will also find that while you are removing the skin from, then you see that some fibers connect the skin to the underlying deep fascia, the fascia over the pectoralis major, and those fibers you will have to cut, then you can reflect the skin. In this way, we say that the subcutaneous fats and the fibers connecting the skin to the deep fascia, combinedly it is being called a superficial fascia, which of course it does not deserve the name because the fascia means sheet, but it is not a proper sheet. Anyhow, it is being called. And then another special point is that present over here on the surface of this muscle, the fascia is the deep fascia. And then the skin, between the skin and the deep fascia, which is also called as pectoral fascia, in case of female, lies the mammary gland. Then another modification or specification of the superficial fascia of this pectoral region is that present deep to the skin, there are thin muscle fibers which are attached to the under surface of the skin and then ascend upward and are attached to the lower border of the mandible. These thin muscles which present in the upper two spaces of the thoracic region and attached to the deep surface of the skin and attached over here, this is being called as platysma muscle. This is the skin muscle, or this is also called as the panniculus carnosus. So, and the skin muscle in the human being are not well developed. In animals, the skin muscles are well developed. And you would have noted that the animal can shrink the skin upon itself, while the human cannot. And only in this region, there is a skin muscle which is being called as platysma muscle. One skin muscle is present over here, which is called as palmaris brevis muscle, panniculus carnosus. And another skin muscles are being present over here in the ear, that is auriculus at anterior at posterior. But these muscles are also not well developed, but they are rudimentary. That's why you would have noted that the human cannot move the ear like that, but the dogs can. So this is the special about the superficial fascia of the pectoral region. Thank you.